Hello and welcome to the Tip of the Week. I'm Dr. Amy Starr with the Mesa Veterinary Clinic, Paws and Hooves Mole Veterinary Services, and San Francisco Stables. So a lot of people have questions about how to give medications to their pets. So this week I'm going to cover that. I have a couple of suggestions for you that may help, and I also want to go over medications in general. So a couple of things are important. As far as over-the-counter human medications, you need to be extremely careful, but because there are medications such as Aleve and ibuprofen, which are extremely toxic to pets, and you never ever want to give them. There are other medications like Benadryl that are okay, and if your pet has an allergic reaction, it's okay to go ahead and give that. We do always recommend that you check with us before giving any human medications, just to be on the super safe side and know that it's okay for your pet, and also know the dose. We can give you an estimated dose if you know your pet's weight. Also, there are medications that we give out that are prescription medications that need to be followed very specifically. For example, antibiotics and steroids have to be given exactly how we specify, and they have to be given for the exact amount of time. A lot of times I see people starting with the antibiotics, and maybe we've given a 10-day course and the owners only give 5 or 7 days, and then they stop giving it because they feel that the animal is okay. That is actually really dangerous for numerous reasons. One is because you may not be getting rid of the infection completely, and it might just come back with a vengeance. Secondly, is you're actually training the bacteria to be resistant to that antibiotic, which means that in the future you may not be able to use that same antibiotic, and you may have to go to stronger and more expensive antibiotics. And third, you may, just not be treating the problem. You may have leftover medications that maybe you want to use later and they're no good because they're expired. And as far as steroids go, you have to give it at a tapering dose. You never want to just stop immediately because that can also cause problems. So anytime you're given a medication by the doctor at the clinic, make sure you give it exactly as it's specified. If you have any questions or you feel that you want to stop the medication, go ahead and come in and let us do a recheck exam and make sure that everything looks okay. All right. And then as far as actually giving medications, there's several different ways that you can do that. The main way, obviously you can put some of the medications in little food boluses. So get little canned food or some Cheese Whiz or cottage cheese or something, and put the medication and try and hide it in that. There are also things called pill pockets that you can purchase at PetSmart. That you can hide the pill in, and the dog will eat the little treat, and the pill is hidden in the treat. And then lastly, sometimes you need to just kind of shove it down their throat. And the main thing to do is open the mouth. I usually recommend going over the bridge of the mouth with your hand and opening it, like for example with your left hand over the bridge of the mouth, and then with your right hand push the lower jaw down and hold the medication, the pill, in your thumb and index finger. And with your index finger, shove it all the way back past the curve of the tongue, the base of the tongue where it attaches in the back of the mouth, and shove it all the way down. You kind of make them gag a little bit, but you know that if you do that, then they won't be able to push it back out with their tongue. Especially cats are really good at being able to push those medications back out. So you want to get it all the way back so they can't taste it and they can't push it back out. And if you have any questions, just go ahead and bring your pet on in, and one of our technicians can always show you how to do it as well. All right? Have a great week, and I hope this helped. Bye-bye.